Hi friends, this is Dr. Sunil Richardson again. I'm a facial plastic surgeon. I practice out of South India and also out of the Middle East. In this short video, I'm going to try and answer some of the commonly asked questions. One such question comes from this gentleman, Rajkumar. Very interesting, pertinent question with regard to rhinoplasty. His question is thus. He says, will that broken nasal bone join back after surgery? Will that impact in the future? Like, will I have breathing issues? And the third part of the question is, what if someone unfortunately hits the nose on the front side or on the side and it causes a fracture? So these are very pertinent questions, especially when we're talking about rhinoplasty that involve osteotomies. What are osteotomies? Osteotomies are planned fractures of the bone. Let's say the nose is bent and I have to make it straight. Now you have to remember the nose is made of bone, cartilage and soft tissue around it. But the structure, the foundation is the bone. Even the septum that's in the middle of the nose is partly bony, partly cartilaginous. So what I'm trying to tell you here is the foundation of the nasal base or the foundation of the nose itself is basically bone. So whenever we have to change the shape of the nose, so we have to do osteotomies. Osteotomy, as I mentioned, is fracturing the bone in a planned, precise manner. Now, there are different types of osteotomies. I wouldn't want to get into the technicalities of how we go about fracturing the nasal bones. But to answer the questions of Raj, the important thing here is, once you fracture the nose, it's very pertinent to bring it back together. For example, if a patient has a fracture of the hand, the surgeon or the doctor, what they do is they get it back together in its contact. That is critical. You need the bones to be in contact and you also need it to be stable. So it shouldn't be moving. So for that reasons, after we do the nasal osteotomies and I fracture the nose, either we bring it closer or we change a curved bent nose and make it straight, we put splints. Splints ensure that we have bony contact and it also ensures that it stays put like that. So this is very important. So when we do that, what happens is body heals. Body heals in such a way that there is no fracture anymore. It's one smooth continuous bone onto the upper jaw, maxilla or the frontal bone, right? So that's the first part of your question, which I'm trying to tell you that if you do a proper osteotomy and if you do a proper splinting, the patient takes a good care, it's going to be healed and it will heal perfectly. Now, does this cause breathing issues? No, it doesn't cause breathing issues if done correctly. However, breathing is a tricky issue. There are a lot of things about internal valves, there's things about external valves, and we put in various grafts. We make sure we don't compress it that much. So the scans help us, and most importantly, experience helps as well. So if you do that, then there's going to be no issues with breathing. That's the second part of your question, very pertinent. And third one is an interesting question. What if it fractures again? Absolutely good point. I've had many patients who had their nose fractured. In fact, nasal bone happens to be one of the most common bones on the human skeleton to fracture. Why? Because it's sticking out and it's very weak. It's probably 1.5 millimeters at most, thickest. So it tends to break. So then what is the solution for us? It can break, of course. You're playing football, or let's say somebody hits you with the elbow, or you're playing cricket and you get knocked, it can fracture. But that doesn't mean that you can't fix it. Even if you've had a rhinoplasty, and as I mentioned, we've done an osteotomy and everything heals back, it's like you have a good nose now, right? And then it can fracture, sure, but we can fix it back again, like how you would put a nasal bone fracture back for any individual for that matter. So you don't have to worry and think that just because you've had a rhinoplasty with the osteotomy or with the nasal bone osteotomy, oh, my nose is going to be weak, oh, it can fracture very easily, oh, if someone touches my nose, it's going to move. No, that's not going to happen. But does it mean that it can never break? No, it can break because it's a thin bone as it is. But you got to be careful. And the good thing is, even if it does, the way how we fix a normal nose that opportunity is there for you as well. So I never tell my patients not to play contact sports after rhinoplasty. They shouldn't play for 4 to 5 weeks. And I told you why. But it's not that they don't play contact sports for life. That's not on, right? So I think you got my message. It's actually been very interesting for me to respond to so many interesting questions my subscribers are putting forward. Well, some of them are really intelligent, really nice questions that makes me think as well, and I'm trying to give you answers that maybe you understand what the crux and how, because by our training, being physicians, being maxillofacial or whatever our training is, we tend to think in different ways. And when patients or when people ask us subtle basic questions, that makes us think, and that makes me tell you things in probably much more simpler fashion. So keep shooting your questions if you have any doubts, and we'll be more than happy to answer them. And if the question is warranting a video like this one, we're happy to take a video after that. Thank you.